It's my pleasure to be here. I'm my co-chair on the Idaho Behavioral Health Council, Sarah Omenson. She's actually on vacation, so she sends her apologies for not being representing on behalf of the council. And it's been a really unique experience. I can tell you that at all levels of state government, the leadership is very focused on how do we help improve behavioral health for the citizens of Idaho, for the people that live here, so that we can have better outcomes, so we can have recovery, resiliency, and better outcomes for individuals and access to services as they go along. I can tell you there's only one other topic that the governor talks to me more about than behavioral health. You can fill in that blank on that. Now, I'm not going to go, that's a different speech for different audience. And so behavioral health is top of mind for him. As the governor mentions, the Supreme Court is very focused on behavioral health. They've invited me over, very generously invited me over multiple times, solely to talk about behavioral health. Not only just how it interacts with the court system, but how as a state we can move forward. And the same is true of any legislator that I've ever spoken with. And that's how the Behavioral Health Council was formed, is through the three branches of government, through local government and providers and representatives of the community. And our goal is to really look at the entire behavioral health system. Our objective was to not just dive into one problem, but really step back and look at the whole system and say, in the whole system in Idaho, what's working well, and we need more of that. What's not working well, and how do we fix that? And what's just missing, and how do we get that into the system? And that's really been our purpose. And for the sole purpose, we're at this kind of macro system level, but it all matters for individual people. It matters in individual people's lives. And it makes a difference. It makes a meaningful difference in people's lives when they have access to services and get into recovery. It was pretty early in our process, what we call it the protractor. The governor mentioned that. But that has recovery as in there. Recovery is a key piece of what we've been focused on as a council. Because recovery, well, how long does recovery go on? It's a lifetime, right? It's an important piece. Otherwise, we start that cycle over. And so within the plan, I noticed you guys highlighted a couple in the yellow sheet here. On this yellow sheet, it's got a QR code, by the way, that you can look at the whole plan. This is a paper copy of it, and it's out there on the website on that QR code. But we have a couple of things that we actually prioritized up to tackle first. And one of those was, two of those were in recovery. One was to identify services to support long-term recovery for individuals in Idaho. The governor has been very generous. Every year he's added money to my budget to make sure we can support recovery centers. I know he'll continue to do that. The legislature has supported that every time. And we need to put a plan together with all of you to make sure that we have a long-term sustainable recovery approach and system in the state. The other item in here in recovery is to identify opportunities to enhance protective factors and promote long-term resiliency in children and youth who have experienced trauma. Trauma is one of the sources of many of the things that impact people's lives negatively. Are you guys familiar with ACEs, adverse childhood experiences? It's something that's most people know about now. You probably know the data is very clear that the more ACEs an individual has in their life, the more impact it had, on all aspects of their life: economic, behavioral health, substance abuse, even lifespan. The data says that if a child has 7 ACEs or more, they're going to live 20 years less than the average person in the U.S. And so really focusing in on that trauma. And in my mind, resiliency and recovery go hand in hand. I think of recovery as coming out of some of those substance abuse and behavioral health episodes, and resiliency is coming out of trauma. And that not letting that trauma define that individual, but allowing that trauma to be something that they have resiliency for and move forward. Ideally, we don't have any trauma to begin with, but we're not quite there yet. We're going to keep working on that. In the meantime, we'll focus on resiliency. The other thing I would just say about the strategic action plan is we're not done. We have the plan. It's a strategic action plan. We intend to make a difference. We have the executive order that created it is 4 years, so we have 3 years left. We intend to make a difference. We want these things to come to life. And the way we can't do that alone. We can't do that as one. This is a big problem. Any individual. You guys, in literature, there's a difference between the villain and the monster. And so I'll give you a little, this kind of illustrates my point here. The villain in literature, to overcome a villain takes a hero. And that's the motif that's in most of our literature and popular culture, is the villain-hero scenario. And that overcomes the villain. And a monster, the difference is it takes the whole village to overcome the monster. And that's the problem that we're dealing with here with behavioral health. It is going to take the whole village. And so what we are hoping is this becomes the roadmap for all of us, for all of you in this room, as we move forward, that we can get our oars going the same direction, that working together we can accomplish these things we've highlighted, to give some directions to each of us as to where we can put our effort in, so we can come out at a better place that better serves the people of Idaho. And that's already starting to happen, as evidenced by this meeting tonight, actually. And the last thing I want to mention is the guiding principles. As we finished up the strategic action plan, we really realized in addition to the recommendations, we really wanted to describe how we wanted this work to unfold. And I'd encourage you to read those. There's 7. There's 2 that were highlighted on your yellow sheet, and I'll just call them out. The first is, this must be consumer and family voice. And in each of these principles, we have a we commit. And I'm going to read this one because it says, because the voices of consumers of services and their families are crucial to proper implementation of the Idaho Behavioral Health Council's Strategic Action Plan, we commit to include them as indispensable partners in program design, implementation, and evaluation. My experience is solutions designed without those they benefit don't often work well. And so we are committed to making sure that we include the consumer and family voice. And then I'll skip down to number 4, which is recovery and resiliency oriented. We commit to design a system that focuses on the lifelong process of improving wellness and strives to assist consumers and families in reaching their full potential. And that's the key element of how we move forward and makes an ongoing difference in people's lives. So thank you for letting me be here. I'm super excited that you guys are talking about the Behavioral Health Strategic Action Plan. That means it's already starting to work. I'm thankful for the leadership that has come out of the Twin Falls, the Region 5 area. It's phenomenal. I had a chance to tour a couple of years ago the Crisis Center as well as the Recovery Center. I was blown away with the resources you have here. And in my mind, that's just the beginning. So thank you for all you're going to do. Appreciate you very much.